So today was my first day shadowing at a hospital. So my day started with first I had to buy a lab coat, like a white doctor lab coat, and I got a name tag with my name on it, saying that I was a trainee and that I was a shadower. And I had to wear those two things around the hospital, or I wasn't allowed into the rooms without wearing them. So today, my first day, I dealt with a lot of different types of people, a lot of patients, a lot of different ages, ranging from a 7-year-old girl to like an 80-year-old old lady. I also dealt with many different nationalities, from UAE to Palestine to Egyptian and so on. So one of the I was introduced to many diseases I've never heard of, and many medical issues, and I was also taught or explained to on how to treat them and how to better deal with them to help the patient. So first there was this man, like a middle-aged man with an IBS disease and diarrhea, and he complained of nausea and fever. So I learned that IBS was an inflammatory bowel syndrome, that some symptoms of it would be a lot of constipation or a lot of diarrhea or some of both. I also learned how to better treat it, what the person should eat more, some medicine, etc. So during the man that was visiting the patient, the doctor taught me how to run an abdominal test on him. I didn't do it, of course, because I'm only a shadower and um, I'm still gaining experience. But I watched her do it carefully, and she explained everything that she did. She explained it later when the patient left the room on me and on herself. She taught me what it meant if one area of the stomach was harder, where I should start, if I should go deep or just on the surface of the stomach, that how the spleen can get enlarged, that like the inflammatory IBS, bowel syndrome, can happen, like if you listen to the device where you listen, if you hear a lot of rumbling, that means the syndrome could be happening. If it's really little, then no. And she taught me that sometimes there's some cases where if the pain is on one side and you go deep on the other side, the pain will still be on the right side. Like, for example, if the pain is on the right side and you go deep on the left side, the pain will still be on the right side because one of the organs have gotten enlarged, which is what you feel with the deep going into the abdomen. And yeah, and there was also this really old lady who used to be a doctor that came, and she complained. She was 47 years old. She wasn't really old, but she complained that she had low hemoglobin and iron deficiency, and it was chronic rather than acute. So the doctor informed me later that if it was acute, she could just have a blood transfusion, everything would be better. But because it's chronic, you can't do that. So we had to think of another solution. Other than abdominal testing, I also learned how to do a dehydration exam and how to deal with IBS. I also learned another similar disease called IBP. So there's also the dehydration exam to tell, like, for example, if the tongue is dry or white, it shows that you're dehydrated. If your lips are dry, plus if you press on your finger and the blood takes a long time to come back, it takes a long time to turn red, that means that you are dehydrated. I was involved with many kids too, and many of the elderly. There was this little, like, my first patient was a 7-year-old child who complained of vomiting and who complained of diarrhea, nausea, huge headache, and she came in with their grandmother. They knew no words in English, so I had to talk in Arabic to them the whole time. I had to translate from English what the doctor was saying to Arabic, like in a better way. So the 7-year-old girl actually vomited many times during that stay, around 3 to 4 times. So I kept bringing her water. I offered water to the old lady as well. I was like running to get water, running for another cup, running to show her the bathroom, cleaning up her vomit in the sink, etc. And I started a conversation with her so that she wouldn't feel so scared and awkward about like what school she went to, etc. Um, Also, I encountered a patient that fainted after she got a vaccination, which was interesting. So I encountered a 36-year-old patient, a male, who just got diabetes. He knew that he had the start of diabetes, but now it was getting really, really high and it could actually begin. So apparently diabetes starts at a scale of 6.5 and he's at 5.9 now, so he's really, really close. And I dealt with like how to make him feel better and advices to give him, and I understood how or why he's closer to getting diabetes because of lessened activity, more sugar, etc. I also learned how to check, when you examine a patient, how to check for the lymph nodes here, and how to check up with the breathing device and like the ear device and like looking at the throat. Um, I learned a lot about the hemoglobin and about IBP, IBS, and diabetes, how to treat them, etc. There was also a patient who just came in to ask about travel vaccine to Malaysia, and I helped that patient a lot because I went to Malaysia, so I could give um, my own like experience and advice, and for example, telling the patient to put a lot of mosquito cream on and sleeping under nets and not to drink from any unknown water sources. So I increased my awareness of my strengths and areas for growth because I know that I'm patient. There was a lot of times if I was at the hospital from 8 in the morning until 4, that is 8 hours, and there were a lot of times where some patients just took so long. One took up to an hour and a half, not maybe even more. I lost track of time. Sometimes there was long gaps with no patients. I just had to sit there with no internet, just worrying about all the homework I had to do, just sitting there. So I realized I was patient, realized that I'm strong at starting conversations and getting patients involved and being nice to people and being helpful. But my growth is maybe expanding in my languages because I understand Arabic, I understand English, I can speak them both, but my Arabic isn't too perfect, so I should improve in how to speak to other people because they have different accents, so it's harder to understand all of them, and it's harder to communicate with all the different accents. For example, Egyptian is really different than local, and it's different than Palestinian. I mean, local by UAE and different Palestinian, etc. I undertook new challenges because it was my first time shadowing at a hospital, learning a lot of medical procedures, abdominal testing, looking for the lymph nodes, um, dehydration testing, etc. It was a challenge staying patient, dealing with all the patients, all of them from different cultures, um, treating the doctor differently, talking differently, having different senses of humor, etc. I planned and initiated activities because it took me like a really long time to reach this high place. Like I had to write a CV for myself in order to be accepted into shadowing and write about my past experiences, all my personal information, etc. And I waited for like 4 months until they answered me. And so I planned it and I initiated by going every single day from 8 till 4 on time, not being late, getting the lab coat, getting a name tag. I worked collaboratively with others because I collaborated with a doctor. I asked them because I was with many different doctors. Once with a family doctor, once with a pediatrist, once with a consultant. So I collaborated with them all and I helped them in different ways. I also asked them many questions about medical school, about studying medicine, about like how they went through it, their daily life. I worked collaboratively with the patients. I was nice to them. I wasn't rude. I offered them water. I tried to communicate to them, tried to entertain them, especially the 7-year-old child who was really scared and always vomiting. I got her water. I gave her grandmother water. I tried my best to help them. I followed instructions. I even did things without being asked to do so. I was committed because I'm attending from 8 till 4 every day during my winter break, which is kind of hard getting up in the morning, being tired the whole day, coming home late around 4:30, and then starting all my homework around 5, not to mention having lunch. So really my day is just hospital, homework, sleep, hospital, homework, sleep. And it's nice, it's a really interesting place, but it is also a lot of hard work. I developed a lot of new skills, a lot more collaboration, cooperative skills, more patience, learning how to undergo medical procedures and how to carry out medical testing, medical practices, how to follow instructions carefully, how to deal with all the different types of people there. I considered ethical implications as I aided many different patients of many different types of people to many different ages, ranging from really young kids to really old seniors. And the young kids, I tried to talk to them, engage with them so that they wouldn't feel so scared and bored and intimidated with all the machines. Tried to make it feel better. Talk to them about school, about animals, about anything that would interest them. And I was also moral and demonstrated my ethics to older seniors by making them feel better, by ensuring that they would be okay, by ensuring that, for example, the old lady, the grandmother that came with the 7-year-old granddaughter, I ensured her in Arabic because she didn't understand English. So I tried my best to communicate to her and ensure that her granddaughter would be fine and that it's just something normal, just a virus. She doesn't have to worry about it. That I just tried to engage with her and tried to make her think about something else, and I tried to bring like a friendly and kind atmosphere so that they wouldn't feel intimidated. So after my first day, I realized like that hospital shadowing, working at a hospital is really fun. It's really interesting. It's not exactly fun. It's a lot of hard work, a lot of writing about medical things, typing about all the symptoms the patients have and how to cure them, a lot of research during the time of the patient, a lot of hardships, a lot of instructions to follow. But then it is interesting and it just feels really nice helping those in need and making like knowing that you made a difference in how they feel and making them feel better. It just makes you feel good to help others. So really I'm looking forward for the continuance of the week, and I'm really excited to see what patients I'll bump into next and how I can help them. So yeah.